Hello, my name is Dr. Abdul Hadi Hussein. I am an orthopedic and spine surgeon in KPJ Tawakal Specialist Hospital. Firstly, I will talk about the anatomy of the spine. Spine, we have three regions of the spine, namely the cervical region, the thoracic region, and the lumbar region, which is the lower back. And the lumbar region also usually it's articulating with the pelvic. So pelvic also is part of the spine unit. The lumbar region consists of 5 lumbar vertebra and 1 pelvic vertebra, which is the sacrum and the sacrum and pelvic. In between the vertebra, there is articulating unit consists of 2 joints at the back, which is the facet joint, and 1 joint, special joint in front, which is called the disc. The main problem that causes back pain usually comes from these 3 structures. Whereas the sacrum consists of 1 single united bone, which is S1 to S5. Okay, and on the lower part there is a pelvic which articulating with the sacrum, which also can be the cause of back pain. It can be because of trauma, which usually the main cause. Trauma, you fall off, you fall down, you met with an accident, the way you carry heavy weights, heavy objects at your workplace or anywhere can also contribute. Apart from that, there is a degenerative problem, means that there is age-related changes that occurs to the spine. The changes occurs both at the facet joint as well as at the disc. Because of this, it generates some pain that causes the whole back to be painful. The more uncommon causes usually is infection, whether it's tuberculosis, TB can also occur in the spine. Also, sometimes bacterial infection also can cause back pain, and the presentation usually a little bit more severe. Apart from that, there's a tumor that actually can occur at the spine, namely multiple myeloma, plasmacytoma, and also some other tumors that actually occurs elsewhere but metastasize to the spine. This causes abnormal integrity of the spine, and some usually cause collapse of the spine that leads to back pain. For some instances, there's no known causes of back pain, but why back pain occur, where every investigation is normal but patient experience back pain. This can also occur condition what we call fibromyalgia. What are the symptoms of back pain? Where usually the pain occur? Mainly is at the back, lower back, at the gluteal region. It can also radiate to the thigh, the leg, calf region, as well as the foot. Whereas for tingling and numbness, tingling sensation and numbness, it usually occurs over the buttock region, over the posterior calf, as well as at the foot. Why is it that this tingling and numbness sensation occurs lower down comparatively to the back pain? This is because the nerve that comes out from the spine supplies the leg as well as the foot. So when there is a compression at the spine, you will feel the effect at the area where it's being supplied by the nerve, namely the leg region or at the foot region. How do we prevent back pain? One is back care. We need to make sure that our sitting position is correct. Okay, try to avoid sitting position or standing position in a long period of time, that actually can cause stress to the spine. We have to actually make sure that our posture is correct. If our posture is not correct, it also can affect to the spine and causes prolonged and debilitating back pain. Posture when carrying heavy things also need to be taken care of. And also we need to avoid sitting in one position for a long period of time to make sure that the flexibility of the spine is there. You need to do back exercises, consist of back strengthening exercises and also back stretching exercises. Both actually important to make sure that our posture is good, because we need the elasticity of the spine as well as to reduce the risk of injuring the spine. How can we treat back pain? One, the most important thing is we have to identify what are the cause of back pain. That comes the investigation. Usually we need to do plain x-ray of the spine to see if there is any bony changes that may relate to the occurrence of back pain. Apart from that, we should actually do also an MRI of the spine to see whether is there any soft tissue changes, any nerve compression that occurs in the spine itself. Treatment for back pain mainly conservative, because most of the causes of back pain is actually because secondary to trauma or work-related problem. So treatment mainly conservative by means of doing regular physiotherapy, taking some painkillers to ease off the pain for a short period of time, at times taking some anticonvulsant therapy to reduce the incidence of neuropathic pain. We call it neuropathic pain. If conservative treatment fail, then we can offer injection therapy such as epidural steroid injection, nerve root injection, radiofrequency and also nucleoplasty to reduce the load to the spine, and in times usually helps to ease off the back pain. This treatment usually temporary and can last for a period of 1 to 2 years. Exercise therapy, physiotherapy, it helps to maintain the pain-free period for a long period of time. Surgery will be the last resort. This is if there is nerve compression symptom, then surgery will be indicated. And also for some patient, for instances, the pain is intolerable and it has been going on and is causing a lot of problems in daily activity. So indication for surgery will depends on what are the causes of back pain. Of course, if it's because of tumor or if because of infection that requires surgery, then surgery will be the main choice of treatment. In short, if you have back pain, please consult your doctors so that you can be investigated further and to ascertain what are the causes of back pain and to get a proper treatment for your back pain. Thank you.